So if we look at neural control of blood pressure, we are looking at how the brain works with blood pressure and blood flow. So the cardiovascular center of the brain is the medulla oblongata, which has a group of neurons, and they work to regulate blood pressure and flow because the cardiovascular system regulates heart rate, it regulates its contractility, and it also directly affects nerves going to blood vessel diameter. So we've got vagus nerves that are parasympathetic, and the vagus nerve does not affect your blood vessel diameter at all, but it does decrease the heart rate. And we know that a decreased heart rate decreases cardiac output, which will lower blood pressure. Two sympathetic nerves, the cardiac accelerator nerves and the vasomotor nerves. Cardiac accelerator nerves are related to the heart, and the cardiac accelerator nerves increases heart rate and contractility. So both heart rate and contractility can increase our cardiac output. Vasomotor nerves go directly to the tunica media in your blood vessels, and what it does is causes vasoconstriction, which increases the resistance in your blood vessels, which increases blood pressure as well. Now, all of these can be affected at the cardiovascular center from higher brain centers such as the cerebral cortex, limbic system, and hypothalamus, from proprioceptors, baroreceptors, and chemoreceptors. So we'll look at each one of those. Baroreceptors are especially important in blood pressure. Baroreceptors are pressure-sensitive sensory neurons that are located inside of vessels. And if you have these in areas, we'll think about like your carotid artery and your aorta, they can be very sensitive and they can monitor stretching. So if blood pressure gets too high, it will drop the heart rate so that we can bring it back into an acceptable amount. So these are very sensitive, stretch-responsive nerve endings that sit inside of your large blood vessel walls. Actually, if you palpate both carotid arteries at once in your neck, it can cause the heart rate to drop and cause you to temporarily lose consciousness. This is called the baroreceptor reflex. Parasympathetic control. We lack parasympathetic control to blood vessels. We said that vasomotor nerves are sympathetic, but lack of vasomotor stimulation does not cause vasoconstriction, which would cause relaxation and vasodilation. But notice that is due to lack of sympathetic control, not because we have parasympathetic control to blood vessel walls. We do have the vagus nerve that goes to the heart that lowers heart rate. So lowering heart rate and lack of that sympathetic vasoconstrictive control to our blood vessels will lower both resistance and cardiac output, lowering blood pressure. So if blood pressure increases, the baroreceptors in your carotid arteries will increase stimulation, and that will cause action potentials to fire and be picked up at your cardiovascular center of the brain. Your cardiovascular center of the brain will respond by vagal nerve stimulation to the heart, lowering heart rate, and a lack of vasomotor supply to your blood vessels, which causes relaxation and vasodilation. This lowers cardiac output and resistance, bringing blood pressure back into normal ranges. In the opposite, if blood pressure decreases below normal range, baroreceptors will detect that there is a low blood pressure and low pressure stimulation. This will also be alerted to the medulla oblongata, the cardiovascular center of the brain, which will respond by doing the opposite. We'll block vagal nerve control to the heart, and we will stimulate cardiovascular accelerator nerves. And those cardiac accelerator nerves will increase both heart rate and contractility, increasing cardiac output. And it will also stimulate the sympathetic vasomotor nerves, which will increase vasoconstriction in the vessels, raising resistance, which will also raise blood pressure. So raising the resistance and cardiac output will raise blood pressure back into normal levels. So blood pressure is controlled strongly by these negative feedback loops. Chemoreceptors are similar, except instead of picking up pressure differences, they are going to monitor the chemicals of oxygen, CO2, and hydrogen. They will detect hypoxia, which means low oxygen in the blood, hypercapnia, which means high amounts of CO2, and acidosis, which means high amounts of hydrogen. All of these may be synonymous with not getting in enough oxygen or letting off enough CO2. And keeping more CO2 will in turn cause acidosis and cause more hydrogen ions to be collected in the blood. So if hypoxia, acidosis, and hypercapnia happen, this will stimulate sympathetic stimulation, and you would have similar types of things. You would increase heart rate, and you would also have the vasoconstriction. So These are located in carotid and aortic bodies as well, but instead of picking up pressure differences, they are going to pick up chemicals, which is related closely to our respiratory system. We'll see as well when we get there. Autoregulation is the ability of tissues to automatically adjust their own blood flow to match the metabolic demand for oxygen and nutrients. So if the kidney, for instance, is not getting enough blood flow, it can adjust by releasing its own little autoregulator chemicals, adjust blood flow just to that organ in spite of the blood pressure and flow that's going on in the rest of the body. So autoregulation happens in several organs. One we will look at in particular is in the kidney.